So we have sort of two ends of the spectrum. We have that patient with a very profound, deep response. And what's that mean for us, and is that important and critical? And then on the other hand, we've got that patient whose tumor doesn't really change in size, but the CEA falls and there's a change in imaging characteristic. One we might call stable or even minor progression. The other we're excited about. How are we starting to factor those kinds of things into our treatment decision making?
Well, I think we're always in a struggle against RECIST. We're always resisting RECIST. The concept of patients on study, for example, who have shrinkage in a lot of tumors, but the appearance of one small lesion. In practice, most of us would probably continue the therapy they're on, and studies they come off. So people are looking at newer measures, the depth of response, and in part using that to try to explain some of the differences in the FIRE-3 trial of why you might have a longer survival and without necessarily a longer typical PFS. So I think we heard last night, many of us heard some new data about studies looking at this in two ways. One of how to manage a patient, and the other as surrogates for overall survival, which are really two different things. I think we just need to move beyond RECIST and use more of these measures, depth of response and the longitudinality of the response.
And I know you guys are the same on this. While we're trying to train our radiology partners in how we think about this, if you just practice oncology with a piece of paper, the report that comes in, you'll often make the wrong treatment decisions. So really going to review those images, partner with your, and our patients are getting scans in community places because that's where insurance says to do them. And so you really can't partner with that radiologist. So it means looking at the disc and really following
It's interesting how often a patient coming in from outside will comment that this is the first time they've ever seen the doctor put a disc in the computer.
Yeah, and back to systemness of hospital care. I mean, one of the reasons I ask patients to come and get their scans at our institution is that, I can use it, I can see it, and it's putting everything in one place is good for patient care. I really think that's true. I want to